I'd like to begin by introducing the members of our DAV Interim Women Veterans Committee. Ladies, as I call your name, please stand and be recognized. Our chair, Belinda Hill from Louisiana. Jamie Foxx from California. Juliet Taylor from Connecticut. And if you stay till the end of the seminar, we will have something small for you to take away, and we have Juliet to thank for the donated items that are included in some of the bags. We also have Kim Hubers out of South Dakota. She's not here, she's in another important meeting, but she will be joining us shortly. I want to thank the committee members for their work over the past year, and personally, I want to thank them for all of their hard work during midwinter and for the launch of our Women Veterans Report. We could not have done it without you. Please, let's give all of them a round of applause. Now, if you're a Department Women Veteran Committee advisor, if you're the Women Veteran Advisor for your department, will you please stand? First, I want to thank you for continuing to serve your fellow veterans. Many of them I'm in contact with throughout the year. And if you have any questions about how to become a Women Veterans Committee advisor in your state, please seek out one of these advisors and they should be able to assist you. If you have a special Women Veterans event and would like to request copies of our new Women Veterans Report to share, please send an email to legislativepublic@dav.org and include the date of the event, the number of reports you're requesting, and your contact information. The only thing that I would request from you is to share your pictures of the event, pictures of you guys with the report, and if you post it on social media, please tag us, tag DAV, and we would love to share them. Now I want to give you a little bit of information about today's seminar sponsor. Utska Pharmaceuticals is a company that focuses in the areas of neurosciences and nephrology. They have a strong focus on mental health, primarily with women's mental health. And in 2023, through the acquisition of the company Mindset, Utska is now pursuing the exploration of psychedelics to treat depression and other various mental health ailments. I cannot think of a more perfect partner because we need to explore more options outside of the so-called box, right, to treat mental health. We need to destigmatize emerging breakthrough therapies and listen to veterans when they say we need something else. The status quo is not working and there is no one size fits all. Caroline Fisher has been with Utska for 12 years and currently serves as Director of Alliance Development for the Government Affairs and Public Policy team, the GAP team. I like that. Prior to Utska, Caroline worked in the Massachusetts State Legislature as the Chief Health Policy Advisor to Speaker Robert DeLeo. Caroline is also a yoga teacher studying to be a meditation teacher and lives in Brooklyn, New York with her wife and 2 sons. Caroline, please come up for some remarks.
Good afternoon, everyone. Thank you, Naomi, by the way, for a lovely introduction. It's a real pleasure to be here. As Naomi mentioned, I'm with Otsuka America Pharmaceutical, Head of Alliance Development for Government Affairs. And Otsuka is a company that's deeply committed to advancing mental health solutions and improving the lives of those with serious mental illness. Our innovative commitments span from digital health innovations to groundbreaking treatments, including, as Naomi mentioned, our acquisition of Mindset for psychedelics to address unmet needs in brain health. PTSD, as you know, is a significant issue affecting many veterans. especially women. 11.8 million adults in the US suffer from PTSD each year. And while PTSD is often associated with men in combat roles, it is crucial to acknowledge the unique challenges faced by women veterans. Intimate partner violence, pregnancy, menopause, military sexual trauma. These were all highlighted in the DAV's assessment of the unique factors contributing to the staggering rates of suicide among women veterans. Studies also show that women are twice as likely to develop PTSD as men after a traumatic event. This underscores the importance of tailored support and treatment for women veterans who have served our country with courage and dedication. On average, it takes 5 years from the initial trauma to receive a PTSD diagnosis. This delay can exacerbate symptoms and hinder recovery. We believe that with better awareness and improved diagnostic tools, that we can identify and treat PTSD sooner, leading to better outcomes for those affected. OTSCA supports disabled American veterans because we understand the critical role that they play in advocating for veterans' rights and well-being. Your resilience and dedication inspire us to work harder and push boundaries in our research, and with organizations partnering with organizations like Disabled American Veterans, we aim to create a future where PTSD is recognized early and treated effectively, ensuring that every woman veteran receives the care and support she deserves. So lastly, I would just say thank you so much for your service, for your strength, and for allowing us to be a part of your journey towards better mental health. Thank you.
Thank you. Pull the mic down. Caroline, thank you so much for all of the work you're doing, and please know that we will continue to do our part to ensure women veterans have access to treatments that might save their lives. Oh, well. Approximately every 4 years since 2014, DAV has produced a report focusing on the fastest growing cohort of veterans, women. Our first 2 reports focused on the overall state of women veterans and the challenges they face after service. This latest report focuses specifically on mental health. The work on this report began well over a year ago. We've gone back into all of the research done by VA and some outside sources, and we did a deep dive regarding women veterans and mental health, particularly on the issue of suicide prevention. We wanted to know, what are the challenges? Are there gaps in care or services? Where are the vulnerabilities? And with all of the increased care for women veterans in recent years, where are we now? Has there been a change since our last Women Veterans Report in 2018? So we really wanted to answer these questions, but more importantly, what can we do to help?
When I came home from the first Iraq War, Desert Shield, Desert Storm, my father picked me up and he said I had a blank stare in my eye and I wasn't the same.
My husband woke me up one night because I was beating him, because I thought he was an attacker.
I had to have a full hysterectomy, and then it took me months to recover after that.
I had several gang rapes while I was in the military.
I went on not knowing that I was broken for years. What
does VA and Congress need to do to better address women's mental health needs?
Ask women. The VA healthcare system is the largest healthcare system in the world. And we have some things that we got to work out, of course. Is it perfect? No, but no healthcare system is. Are we getting better? Absolutely. Absolutely, because there's people like me. There's a me for me now.
In 2021, there were 350 suicide deaths among women veterans. We also saw the 2021 age-adjusted suicide rate for this population 166% higher than that for non-veteran U.S. adult women. And as you see on the screen, the suicide rate among women veterans rose by more than 24%. Firearm suicide deaths made up more than 50% of the overall women veteran suicides. Our research found that women veterans are less likely to practice safe storage, in part because they prefer to have their firearm readily accessible. Now, some of that may have likely been influenced by the COVID-19 pandemic and concerns of protection during times of civil unrest. But this becomes a problem for a woman veteran during a time of crisis, because research indicates that about half of suicides take place within 10 minutes of the suicidal urge, which makes safe storage crucial in suicide prevention. There needs to be time and space between the thought and the accessibility to that firearm. We feel more education about the importance of safe storage and giving veterans options that isn't just a cable lock or having them give their weapon to a friend until they can get help. A one-size-fits-all veteran suicide prevention strategy will not be effective in meeting the needs of the diverse population of veterans. Women veterans experience challenges related to their military service that may affect them in unique ways. For example, women veterans report experiencing military sexual trauma, or MST, at higher rates than men. 1 in 3 women report experiencing MST. Intimate partner violence, or IPV. Nearly 1 in 5 women veterans using VA primary care reported experiencing intimate partner violence in the past year. Substance use disorder. The risk of suicide death among women veterans with active substance use disorder is more than twice what it is for men. And pregnancy, during pregnancy and up to 1 year after giving birth can be a time of increased risk for a mental health diagnosis and suicidality in patients with a prior mental health diagnosis. Menopause has been shown to raise the risk for depression twofold. These unique experiences can increase the risk of suicide. Additionally, the largest cohort of new women veterans are those women who served in the conflicts in Iraq and Afghanistan. Women veterans who have served in Iraq and Afghanistan may have served in combat or combat support roles, which can add another layer of trauma. One woman veteran may face one of these challenges, but most experience several. The report found numerous gaps in mental health care and understanding related to women veterans. So, what are the gaps? Screenings. Evidence shows a significant number of false negative screens for MST, again, a known risk factor for suicide among many women veterans. Intervention, we also found the algorithm that is responsible for flagging when a veteran is a high risk for suicide when they visit their VHA provider does not screen for MST. So not only are there false negative screenings for MST due to underreporting, but even if it is reported, the system was not counting MST as a risk, potentially allowing that veteran to leave their primary care appointment without getting the help that they need and the opportunity to intervene and help that veteran. Now, VA has told us they're working on an update to that algorithm, but we will continue to highlight this fixable issue until it is actually implemented. Thank you. And if somebody knows how to beat a drum, DAV does. Access. VA reports 1 in 4 women veterans live in rural areas, and that number continues to grow. We know there's already a healthcare crisis out in rural areas, but you compound that with a woman veteran, with all of the unique challenges that have been mentioned, there's even less access to the gender-specific tailored care that she needs. We also found gaps in training. Women veterans rely heavily on community care, and all maternity care is done out in the community. Rural veterans also rely heavily on community care, and specifically gender-tailored care out there in the community through VA. So, one of our most shocking and frustrating things we found in our research was that community care providers are not required to be trained in suicide risk identification and intervention of lethal means safety counseling specific to veterans. We're working with Congress now on language for a bill around this issue, and actually this morning a bill did drop. Look for it. It will come out in your can. I will encourage you right now to go to davcan.org, davcan.org, and when you get that email message, please take action so your congressmen, congresspeople, Senate, Congress in general, can hear from you, because we have a loud voice and we need them to hear us even louder on this issue, right? Please, davcan.org. I know, I'm from New York, I'm sorry. DAV, Charlie Alpha November. Understanding. While we were looking at research, we found that the reproductive life stages on mental health and suicide risk among women veterans is understudied. Awareness. Many women veterans say they did not even know they were eligible for VA health care or were unaware of the resources that were available to them. Now, we're not going to put out a report just finding where the gaps are, but as you learn in the military, if you bring up a problem, come with a solution. I love it. In our report, we make over 50 policy and research recommendations. Some suggestions include VA must revise its algorithm for predicting suicidality to incorporate risk factors weighted for women veterans by using MST as a predictor. In fact, we believe MST should be a central pillar of all suicide prevention efforts, and require community care providers to train in suicide prevention and lethal means testing. VA must develop solutions to bridge the gap in mental health care services in rural communities. VA should assess the need to increase gender-specific programming in their residential rehabilitation programs. Women veterans have disproportionately high risk for intimate partner violence. Just as everyone is familiar with 988, press 1 to reach the National Crisis Line, we feel a similar approach to the National Domestic Violence Hotline should be made for instances of domestic violence. Create a 3-digit number that would be an easy-to-remember number during a highly stressful situation and possibly help save that woman veteran's life. We encourage VA to look at the life cycle of a woman, and VA should focus their research on the intersection between menopause, polypharmacy, or taking different medications, and high-risk factors such as military service and suicide. I'm happy to report they're working on a study now. I want to highlight a few women veterans that were highlighted in our report. Nancy Espinoza, or as we know her here, which is Madam National Commander. That's right. Served from 1975 through 1990 during the Desert Shield Desert Storm era. Constance Cotton served from 1988 through 2004 during the Gulf War and post-9/11 era. Penny Laveau served until 1990 during the Gulf War era as well. The reason I wanted to highlight these amazing women whose vignettes are in the report is just because I feel it is important to show that we did not just focus on those who served in this past war, but the ones who preceded them. For had it not been for those that came before my time, we would not have gotten the healthcare services and benefits we have today, and we are far from done. Thank you. So thank you for listening to our important work. We have gotten a lot of positive engagement with other VSOs, the VA, and lawmakers after they've read the report. There has been some legislation drafted, as I mentioned, with some recommendations that come straight from our report. As you know, though, Congress moves at a snail's pace. If you were listening to Randy's report during the joint opening session, you heard how little has been done this Congress. But they have definitely engaged with us and continue to send us draft language of bills that have direct ties to the report. Our report's been cited in many remarks during meetings, roundtables, and hearings in both the House and the Senate, and we will continue to stay engaged with members' offices, and we encourage you to please, again, take action on that CAN network when you send an alert. In February, we launched the report by conducting a briefing up on Capitol Hill to Senate and House staffers, which was sponsored by the chairman of the Senate Veterans Affairs Committee, Senator Jon Tester from Montana. We also had Senator Hirono out of Hawaii in attendance. Many other VSOs, as well as VA, were in the room for our much-anticipated report. It was standing room only. And Navy veteran Jennifer Alvarado, whose story is featured in the report, spoke about her experiences with intimate partner violence, MST, and homelessness, as well as her encounters with VA. She spoke on a panel with world-renowned VA researchers, and she really helped put a face to all of the data that we were throwing at them. The most amazing thing that stood out to me, personally, was when she told me I was so nervous prior to doing this, and I didn't think I'd actually make it through. But I think that this is actually healing me, telling her story. And I'm happy to say Jennifer has found her voice and continues to use it to advocate for her fellow women veterans and DAV. In support of the release of our report, I did what's called a satellite media tour. In 6 hours, we did a total of 24 interviews. 16 were TV and 12 were radio interviews, both live and recorded. This resulted in a combined total of almost 15 million impressions, which has resulted in our most successful media tour, which shows how much interest there is for women veterans and the issue of suicide prevention. But the launch, and if you see, I have a couple of cups of coffee right there next to me. The launch of the report was only the beginning. The interview requests continue to come in, and interest on Capitol Hill, as you can see, Congressman Takano sitting there reading the report. He was very interested and read it cover to cover. So the interest continues, and among other stakeholders as well. We're actively continuing to advocate for this very important issue. Proof of that was when we had the opportunity to be a witness at a Senate Veterans Affairs Committee hearing to speak about the report and the state of VA and women veterans care. Then, on March 11th, we released a special roundtable discussion. It was an intimate, raw, and honest one-hour conversation with DAV Veteran of the Year Kim Hubers and Connecticut Past Department Commander Juliet Taylor and myself about our experiences with mental health and suicidal ideations. The discussion was moderated by our own DAV Communications Associate, Elizabeth DePompey. I knew I was going to mess it up. We open up and tell our stories and what worked for us. You can also find the video on our own special website, womenveterans.org. It can also be found as a podcast on whatever platform you listen to your podcasts. In our report, we had some women veterans share their personal struggles with mental health issues, including some who experienced suicidal ideation. Now, we would like to hear from you. At the bottom of the page on womenveterans.org is a button where you have the opportunity to share your story. Someone from our communications team, Elizabeth, We'll reach out to you. Now, some might see this as a possibility to get their story out there publicly, while others simply find it to be cathartic. There is no wrong answer. You do whatever works for you. In April of this year, Ginger McCutcheon took her last breath after a brief battle with cancer. You saw Ginger in the beginning vignette. Ginger was gracious enough to share her story with the world. You saw her speaking about her trauma in the opening video, and that was, I felt, just so incredibly brave of her. In 2022, she attended Save a Warrior to help deal with her complex PTSD, and she said, quote, "I was a changed person when I got out of there," end quote. Ginger did make it to the launch of our report in February. She traveled from Ohio with a broken foot and in pain, but she did not want to miss it. In this picture, this moment is when all the women veterans were asked to stand. Shortly after this picture was taken, I looked over at Ginger and saw her crying. She was so touched by that moment of acknowledgement, right? And that moment right there is an example of why we are fueled to continue. Though we sadly and unexpectedly lost Ginger to disease, we are resolved to continue her legacy. We did not lose her to suicide. Amen. Thank you again for listening to our important work. We should not lose another battle sister to this preventable epidemic. Let me say that again. We should not lose another battle sister to this epidemic. Understanding the unique challenges is the first step, and now we need to do our part to help save our sisters in arms. Now, when we did that special roundtable discussion I discussed earlier, we wanted to publish it with as little editing as possible. In order to do that, we had to keep it to a 1-hour time limit. However, afterwards, we felt that 1 hour just was not enough. So then I thought, how can I bring this to our members without just doing another video? Should we do it over Zoom? But I felt that that didn't give it the same energy as when we're all in the same room. So I wonder, when are we all going to be together again? Convention. So we decided to bring the roundtable to you. So at this time, I'd like to call up Kim Hubers, Juliet Taylor, and Elizabeth DePompey again. We're going to have a live moderated discussion here today. Now again, this is a raw moment. And while some of the questions have been prepared in advance, the views, opinions, and feelings are our own. So now I will turn it over to Elizabeth.
Good afternoon. Thank you, Naomi, for that presentation. Again, you can read the full report at womenveterans.org. All of the research, analysis, and recommendations in the report are just the beginning. To create real change that can improve and save lives, we need people like you to share your perspectives and to advocate for yourself and for your fellow veterans. While DAV has an incredible national advocacy team, to include Naomi, we cannot successfully serve veterans without dedicated members volunteering their time and energy to fighting for veterans across the country. To talk more about the report and how you can help DAV turn our recommendations into real action, I'm joined by 3 members, leaders, and advocates. You've already met Naomi Mathis, a DAV Assistant National Legislative Director who worked closely on DAV's new report. She's also an Air Force veteran of the Iraq War, a member of DAV Chapter 10 in Arlington, Fairfax, Virginia, and a former DAV benefits advocate. Next, not in order, but that's okay, next. We have Juliet Taylor on the end here, a Connecticut Army National Guard and Army veteran of the Iraq War, and the former commander for DAV Department of Connecticut. She is a life member of Chapter 13 in Stamford. Lastly, we have Kim Hubers, a South Dakota Army National Guard and Army veteran of the Iraq War. Kim is the DAV Department of South Dakota Commander and Commander of Chapter 1 in Sioux Falls. Thank you all so much for being here. Thank you for everyone who attended today. I want to start by talking a little bit more about the report, and then we'll get into some of your personal experiences. So it's been over 5 months since the release of the report. I want to ask each of you how you've been able to use the report and these recommendations in your advocacy efforts and what progress you've seen so far. Naomi, I'll start with you. You touched on the progress, some of the examples that we've seen. Maybe talk about what's next. What do we do now?
What we do now is we get the masses together to help us, to help really put faces to all of this information that's coming out and to, let people know, hey, this is what's happening. First is awareness. It has to be education first. Show them, this is what's happening. And then put a face to it, maybe. This is what's happened to me. This is what happened to my battle sister, right? And then after that, you speak to your congresspeople, speak to your state representatives, and let them know how they can help us help fix this problem, because the culture of the military also needs to change. But here we are, right? We can't change really what happened in the past, but here we are today, and we can start moving forward today from where we are.
Thank you. Kim, can you talk about how you've used this report in your own advocacy efforts, and maybe what kind of progress you've seen in South Dakota?
I'm really happy to report that Senator Thune, is this better? Wow.
Yeah.
It's way better. Great. I'm really happy to share with all you guys that Senator Thune from South Dakota, him and his staff got a hold of the Women Veterans Report, and they took that and contacted our local VA Medical Center in Sioux Falls, South Dakota, and the director there was able to use the information from the report to get a grant to make the VA in Sioux Falls, South Dakota better for female veterans. So I am really proud of my state. Very, very proud. I also just got a box of the reports in the mail the other day from DAV headquarters, because we have a Women Veterans Retreat and a Women Veterans Conference coming up, and I want to hand them out to all the ladies that come to that and make sure they all have it too when we're all sharing our stories, that they can read more stories that are shared, because, like you've shared, keep telling your stories, keep sharing those stories, and things will keep getting better. So thank you.
Juliet, how about you?
So for me, it was a little bit different, because the report was triggering to quite a few people that I spoke with. So I do a lot of work on the college campuses with student veterans. And the report, it kind of brought open conversation and bring forth some shame that people have been dealing with, both male and female. And a couple of husbands reach out to me, and now it start a conversation within the family. So what the report allowed me to do is to start talking about it on our college campuses with our veterans. And these are veterans from not just the Gulf War, but post-Gulf War as well. So I saw there were ages between, I would say, maybe 23 to about 65. Age group that were in college. People are going back to school. Some were professors, and also VA staff that were just working, and that was their coping mechanism. We go to work, we take care of kids, we do things. So it allows us to bring more conversation to our town halls. So we start having town halls. One of our Senator Murphy's office started helping us with town halls. Unfortunately, we had lost one of our VA directors, but we had the nurses at the VA in the women's clinic who actually took over and started helping us to spread the word. So it really helped to open up that conversation, talk about how are we going to manage the shame that comes along with the sexual assault, sexual harassment, and also allowed me to speak to some of our National Guard members as well.
Great, thank you. For this next question, Kim, I'll start with you. What have you learned since the release of the report? Anything personal that you've learned? Anything you've heard from policymakers and veterans that have kind of changed your understanding of these issues?
Oh boy. I think there's more awareness. I mean, for our senator to grab that and take it on and make a phone call and have those conversations, and for our VA to be reactive to it was pretty incredible. I mean, you can say all you want as one person, right? We can all speak up and say what we want as one person, but when you have a whole group of us, you have a whole report backing you when you speak, now you're speaking with a group of people behind you. And I always say, we're like the tugboats that are pulling the boat behind us, the great big boat, and you just have to keep going, and you feel like you're alone, and you feel like you're pulling this big weight, but you have to keep going because you're trudging forward to bring that big old ship behind you in there. And so that's kind of how I look at it.
Yeah. Naomi, what about you? Is there anything that you've kind of learned or you look at differently since releasing the report?
I think, yes, that so many other women are now stepping up and telling me their stories. And I'm in a unique position because I'm the one that they contact, right, for information and to really just want to share their story. And it's kind of that moment where you realize it's not just me. It's not just me that is dealing with all of these other things going on. I mean, you hear about kind of, information like, oh, well, yeah, I dealt with depression or I dealt with PTSD, but you don't really hear about menopause. You don't really hear how that messes actually with your biological makeup and how that also messes with your mental health and your illness that you might already be dealing with. Up on the Hill, they were shocked that we started talking about menopause. I'm sorry, but it was really a great moment to educate. And oh, by the way, to let them know that menopause is not just an older woman veteran issue or older woman issue. I will share with my closest friends here that I went through menopause, started, not perimenopause, full-blown, 34 years old. Now imagine, and dealing with PTSD. So to see that I'm not alone, it's not just me, was amazing.
Yeah.
Just amazing.
Yeah, thank you for sharing that. Juliet, we'll start with you for the next question. I want to start talking a little bit about your own personal experiences with mental health and your military service. What was your transition from military to civilian like for you, particularly when it came to your mental health?
Okay, where do I start? From mental health, I felt unsupported. I felt like, and then there was a component of shame for me as well, because here I am leaving this all-American Army, and it's supposed to be a great experience, a uniform, everything, and then to come home and couldn't get the light turned on in my name, couldn't get the gas turned on in my name, couldn't get the rent, couldn't get a lease because I've been gone for so long. It's been 15 years since I left the state, so I was on no one's radar. And so in order for me to get anything, it's a good thing that I had good friends and my mom was around. So I wouldn't have been able to rent a place. And I had three babies at the time. 2 were teenagers and 1 was in high school. So it was really tough. I went through a period of just struggle before I found my footing.
Kim, what about you? What was your transition like, and how did that impact your mental health?
Well, not to age myself, but I got back from Iraq in 2004, and when we came back then, there was no post-deployment health assessments, there was no, are you okay? There was, we're back, here's your parade, go home, see you in 3 months. I remember very distinctly, about 9 months after we deployed, I was in the kitchen with a couple of guys that were getting coffee, and one of the guys said, I'm just kind of starting to feel like myself. And the other guy's like, yeah, me too. And I was like, yeah, me too. And what I realized kind of thinking about that is members of the military are the only ones who live without freedom. We're the only ones who know what it's like to not be free, for one. We face all kinds of unimaginable things, and I'm going to age myself. I was only 21 when I deployed. I turned 22 in Iraq at Saddam's college in Diwania. So I came back, my ROTC career ended because of my post-deployment health issues with my back and my migraines. It was the second half of my junior year of college, or my senior year of college. So all of my friends had graduated and deployed. The job I'd worked at for 6 years had closed while I was gone. I had no home, no job, no ROTC career. Had to go live with my parents again. Ugh. And and that was awful. Drank a lot of wine. My mom was not impressed. But we came back, and you realize too that life goes on without you when you deploy. And there are not many people in this world that understand that if you disappear, life carries on, and you come back with that on top of everything else, and you have to find a new way to make your life make sense and give yourself a purpose, all while you're dealing with PTSD, but rebuilding your life. All of your friends are gone, nobody understands, and you don't even see the people you deployed with for 3 months. There is no way to be mentally well in that situation, and that's what I came home to. So,
Naomi, how about you? What was your transition like?
So I came back from Iraq at the end of 2003, and funnily enough, if you haven't seen our women veterans, our roundtable, that our part 1 roundtable, we realized that we all were in Iraq at the same exact time. So we're all old. So when I got home, I felt different. I felt like I didn't belong even in my skin. I didn't belong in my body. Everything just seemed so weird. And then I had these little kids that I had to take care of, and I was on all of this medication, and I just didn't, something just wasn't right. And so, and I did reach out and get help after I had my baby was laying there on the bed because I got pregnant shortly after I returned, and I started having really bad thoughts. Let's just say that. And so I reached out. That scared me. It scared me into seeking help. And that moment for me was just really eye-opening. And I was then medically boarded out of the military. The Air Force told me, thanks for playing. And so now I have these 3 kids, and I have no job. Now, the Air Force, I always say, the Air Force did take care of me. They retired me out. They medically retired me out. However, I still lost my job. I felt abandoned. I felt like they just kind of kicked me to the curb after everything I did, my literal blood, sweat, and tears, losing someone, going through all of that trauma. And here I am with nothing, essentially. And so it really was difficult. It was extremely hard. But I think as much as it was hard on me, it was harder on my kids. Because I can take care of me, I can control me, but I can't control how my kids are feeling and what they're seeing.
Yeah.
So it was difficult.
Yeah, and some of what each of you talked about, I think, are transition challenges that any veteran, male or female, can face. But then when we talk about women veterans, there are other things that then pile on top of that. For example, it could be menopause, it could be pregnancy. So thank you for sharing that. All 3 of you are mothers. I'd like to talk a little bit more about that. Juliet, how did your service and some of the things that you struggled with after, how did that affect your family and just you as a mother?
So when I deployed, my daughter was 3. When I came back, she was 5 because we were part of the stop loss. And I first deployed with, first part of my deployment was the Army National Guard, and then I went active after that. But anyway, it was tough. And hearing her tell me, Mom, I thought you went to work before I woke up and came back after I came home. That was a little tough because she felt so abandoned. The boys were a little different, and at one point, my mom couldn't keep all 3 of them, so my daughter ended up in Florida, and my oldest stayed in Connecticut, and my middle one stayed in New York. So they were all separated for a period of time. And so when I came back, not only for me to kind of learn them again, they had to learn to be siblings again. So it was really tough just to kind of manage my emotion, manage parenting, learning that, hey, taking care of a soldier on the combat or in the military is not like taking care of your kids. And so I didn't like them anymore. I kind of did everything to not be around them because they needed too much. And I couldn't provide what they needed. And it was really difficult, and it took years. My oldest right now is, and I will age myself because we all are over 50 that went to Iraq. Many of us are over 50 now. Hey. Okay, many of us. So my oldest, he's still struggling with, and now he has a family, he's in his 30s, he has a family, and he's still struggling with his own children, and where is he? And so with therapy, it's really hard, but we're getting through it. My middle one, he had one older, one younger, but in any case, it was really hard managing the kids, managing myself, and it took years and years, and we're still figuring out where we are. We're lovable now, we can talk, and I've learned how to share and express myself and still teaching them, but they still have those memories that I still don't understand and don't know if I can even fathom how to get them back on track. It was still tough.
Yeah. Kim, how did you navigate, you're dealing with your own mental health challenges, transition challenges, and also you have a family. How did you navigate that?
So when I came back, I didn't have kids right away. I had my kids years later. My med board was 7 years ago, and so my youngest was 3. And so I had 4 kids, ages 3 and up when I went through my med board. And I honestly don't remember a lot about that year because it was so hard and was so stressful. I know I was a parent, I know I was there, but I don't really remember it. So I don't really know how I was as a parent during that time. I don't even know how I was as a friend or a wife or any of those things, to be honest. But I do know that, my kids have definitely felt effects that they shouldn't have to feel because of my service. I know I won't get into it because I'll probably cry more than I'm about to anyways, but there was an accident when we were in Iraq involving a child on a bike with our vehicles, and we drove the second largest trucks the military makes, and I will just leave it there. My kids are not allowed to ride bikes in town on the streets, and I can't help it. I can't get past it, and I feel so bad. I feel so guilty. My youngest is now 10, and I've never let them go ride their bikes around town because I can't handle the thought of something happening to them. So they deal with that, and they kind of understand now, but I didn't tell them for years why. I just made excuses. And I also know, and this is kind of a new thing, but last year when I came out a lot more publicly around here with my medical issues, I had a big flare-up of PTSD, and I didn't really tell anybody. I didn't really talk about it. But not this year, but last year on the 4th of July, we were watching fireworks, and I love fireworks. And all of a sudden, I started shaking and crying, and I couldn't stop. And I ruined fireworks for my kids a year ago. And they still get effects from my service all the time, and they deal with it. Now they're old enough I can talk to them, and honestly, my kids don't really know any different because, that's the way mom's always been from what they remember. But they've been put through a lot. And I probably won't let my grandkids ride bikes either, to be honest. So my grandkids are going to deal with it too someday.
Thank you, Kim. I think that's something that through this report and through some of the stories that you all and others have shared, we've just kind of started to, I think, really broach that conversation of the impact on the family, which is really important, and I hope we continue having that conversation. I want to talk about now your experiences with seeking out mental health treatment. Julia, we've spoken before. I know initially you were kind of resistant to seeking out help. Can you talk about why that was and what finally kind of got you into the VA to seek help?
I think what prevented me in the beginning was, again, a lot of shame and embarrassment. And then just didn't know, wasn't educated. Like, I came back in 2005, didn't know where to go and who to talk to. And then, because it wasn't a part of your outgoing brief. You get out, you go home, go to the VA, you go to the VA said you need this, this, that, and like, DD-214 didn't come in the mail, you didn't have it, or you didn't have the right copy, they sent me back. I had a number 1 copy, they sent me back, and so you need a number 4 copy, and I'm thinking 4 copies. It wasn't until maybe a week or 2 later I realized that there is a number 4 copy of the DD-214. So I did bring the number 4 copy in, but then you needed stuff, and then, so it was really hard, and I was busy looking for work. And I remember the young woman wasn't really nice to me at reception when I went there. So I'm not just going to beg these people. This is like worse than the welfare line. And I'm not going, I'm just not going to go. So I went to work and just crashed and burned at work, on the verge of suicide many times, trying to figure out, what am I going to do? How am I going to do it? When am I going to do it? What am I going to do with these kids? Who's going to keep the kids? And just couldn't figure out how I'm going to leave care for the kids. And so what got me into help was Al Meadows, a friend of mine, a DAV member. And I was at Walter Reed for a while when I came home. And Al Meadows, kept calling me, and I'm like, I don't know why this old man keep bugging me over and over again, driving this DAV van, and I was embarrassed because he used to just show up in my neighborhood, And so eventually he says, we have a trip going down to Walter Reed, and would you come, help us drive down? And it was all Vietnam vets. So I ended up driving down, and that was it. That was 2014. So even though I came home, it was 2005, it wasn't until 2014 I started going to Walter Reed, driving down, and that just kind of plugged me into care and just realized that, and I started helping others. I think that's what kept me in care, is helping others. Once I realized that what I had to say, and people started giving me information where I should go, oh, you did that, well, that was the wrong thing, you should do this. And not only people are walking me through, and then there was a nurse, I have to mention her, Dr. Satchel Shino passed. She was working at the women's clinic, and she, brought me and sat me down and started talking to me about my drinking, about different things, and then really said, this is what you need to do. And then I also saw how my children changed when I started getting better. When I started, not just the medication, but when I started sleeping better, when I started eating better, I noticed that my children they were better, they were nicer, even to each other. And that's what really kept me into care.
And Juliet, you mentioned that nurse and the women's health clinic. How key was that for you, or how important do you think that is to have that gender-tailored care and those resources specifically for women?
Oh, amazing. First of all, I have to tell you, it's not there anymore, but at the time, in Connecticut, our women's clinic was around the corner in the sub-basement near the morgue. That's where the clinic was. Now, we have a 7th floor. We have our own section but Dr. Satchel was amazing. She would call me on a Saturday, because if I didn't make it to my appointment, she will call me and said, hey, what happened? I said, I was out job hunting, or I couldn't find childcare. She would say, bring your daughter with you. But she understood, and at that time, I was also going through premenopausal. She was telling me what was going on with my body. So many issues, and I ended up having like a full hysterectomy, so I went through a full menopause. This was like right in my 30s as well. And so I literally, with her talking to me and sharing with me what my body was going to experience, what my mind, and this is in addition, like Naomi mentioned, to what I've experienced in Iraq and what was going on in my life. Because I ended up having a full pelvic reconstruction surgery because of all the different issues that was going on with me, with the botched hysterectomy. So I ended up in the hospital for a while. So having that female there to deal with me and talk to me and understand my emotion, and didn't take it personal when I just walked in. I'm like, just shut up already. And she just like, okay, let's talk about this emotion. Let's talk about, you know, so it was really important for me. Thank you.
Yeah, thank you. Yes, please. Kim, can you talk a little bit about some of the challenges you faced in accessing mental health care through the VA? I know there were many. If you can give us kind of a snapshot of that.
I've had problems accessing all medical care through the VA. A lot of horror stories, a lot of problems. I was told by my patient care advocate, whoever it is, to file congressional complaints a few times. Most recently, I asked for a Neurolumen, and I was told, if you want it, go drive to Minnesota and go get it, which is 8 hours round trip. So it's okay, Neurolumen's working with me right now. We got it. But I had to come here to get that, right? I also faced a lot of, I don't know if I can flat out say it's discrimination, but that's how it felt. Because I have a lot of strange medical issues. I have a lot of things. When I first really started having a lot of things wrong with me, I was 28. So I got told, well, that can't be happening, you're too young. That can't be real, that can't be happening, right? And I'd go to neurology and they'd say, oh, she's great, it was a great appointment, she's very friendly, whatever. It's all due to anxiety. So I actually had to lie to make another appointment with neurology to get him to fix those records, because Comp and Pen used it against me to try to say I was mentally ill. Now, I'm not saying I'm mentally well, but also I'm saying I have a lot of physical ailments, okay? So I dealt with that. I dealt with those records being used against me at Comp and Pen. I also kept getting sent back to mental health over and over again for things that weren't related to my PTSD, and I would pass something. You know, my first master's is in counseling, so I do a lot to try to help my mental health on my own. I can't help everything else falling apart, but I try to keep this intact. And I went to mental health, and they sent me to a telehealth clinic, and I got through that 2 weeks early, and I passed, and I called back, and I said, okay, please, 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 can somebody see me now? Well, did you finish your program? Yep, came in every day. My husband missed work, left my kids at home, did everything he asked me to. He let me out 2 weeks early, said I was doing everything I could do. Okay, well, you need to go back to mental health again. But I just did 6 weeks of a program. And then I got told on the phone, let me be clear, you're refusing services. I'll go ahead and document that in your file, hung up, and that got used against me at Comp and Pen. And by this point, okay, I'll tell you a fun story with it too, though. They sent me for a full neuropsych as well, and an MMPI. And the MMPI diagnosed me, clinically diagnosed, as optimistically cheerful. So if you guys know why I like to smile a lot, it's a clinical diagnosis. I can't help it. That's my mental problem. But I went through so much with being told. There was one time I was in an appointment, I was shaking my leg because I was in so much physical pain. And the lady wrote she kept telling me, well, I feel like you're anxious. I said, I'm not anxious. I was dressed nice, because I know, you got to look the part, right? I was dressed nice, I was speaking appropriately, and I said, no, I'm in pain. No, I think you're anxious. No, I'm in a severe amount of pain. No, I think it's anxiety. So I had had so much trauma dealing with the mental health side of things at the VA. I couldn't walk in there anymore to receive mental health services, so I chose to go to the vet center and get help there. And then there was staff turnover, and I lost my counselor, and the other two I didn't jive with. One of them did weird things, another one was a man who liked my husband better than me. That wasn't gonna work. So I didn't get mental health counseling for a while, and I know, weird, right? And so I just recently got back in contact with the vet center, and I was supposed to go a couple weeks ago, and that clinician was sick, and I haven't reconnected yet, but I'm working on it. So it's been fun.
Yeah, it's been a journey, huh? Thank you, Kim. Naomi, if you can share maybe some of the challenges for you in accessing gender-specific mental health care, but if you can also talk about what you think the VA does well and is doing well.
Huh.
You got that one. You want them both? You want them both? Go ahead.
So I actually, as I said, the Air Force took care of me. They medically retired me out, and so I continued my care. I was being treated at a military treatment facility. And so I continued my care through the military treatment facility and was able to continue my mental health care there. I did start out, now this was probably around 2008, 2009, went to VA and said, you know what, maybe I need to be around other veterans rather than active duty. Because like group therapy was with people that were active duty and they're mentioning their trauma and what happened with them, and I've got combat PTSD, and they're telling me about their combat PTSD, and I was just re-traumatizing myself. I mean, it was bad. So I said, well, let me go around other veterans, and I tried, and literally the waiting list was like 8 months long. No lie. And I just was like, okay. Now at this point, I'm working for DAV, but I was a benefits advocate, and so I was just like, okay, I'll just continue at my treatment, my military treatment facility. But then my therapist, she retired. And so now I said, okay, well, I guess I'll have to go out into the community. And I went provider after provider after provider. But here's what they diagnosed me with. Chronic severe post-traumatic stress disorder, treatment-resistant post-traumatic stress disorder. And so I said, okay, well, what exactly does that mean? Does that mean like, and I did go to the vet center too. Vet center was awesome, by the way. And they, at the time, did not treat families, but they were willing to say, the counselor, I was close with them, and they said, you can bring your kids in, if necessary, because they were a little bit older and they were having trouble, as you said, transitioning. Anyway, so I said, all right, well, this is not cool. Treatment resistant, what does that mean? Does that mean like this medication's not working? You got another medication? They said, no, you're just gonna have to stay on that medication and just, kind of see your therapist afterwards if you want to. They basically put me out to pasture. I was like, okay. But I found that, and I did it for myself, found healing in telling my story, found healing in speaking to other veterans, found healing in sharing my story and how I felt, and, through all of this. And there was a moment, and I'm going to tell this story because she's in the room. She knows I'm going to mention her, but Delphine. I was in Mississippi, and I found passion. I took the passion that I had for the military and turned it into what I was doing with DAV and for veterans. And so I wanted to stand up, and the VA, there was a panel, we were at a convention, and there was a panel, and I wanted to speak to VA because I had something to say, and I had a bone to pick with them. And so just as you're sitting here, I stood up and I said, well, I have a question, blah, 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 whatever the issue was, and it had to do with VA care, and this. And then I sat down, and they all kind of looked bewildered, like, oh, we don't know how to answer that, whatever the question was. And so Delphine at the time was commander, and she had finished her remarks, and she comes blazing across the room and tells me, can I speak to you outside? And I said, this is the moment where I lose my job. My mouth finally got me in trouble. But Delphine actually encouraged me to use this voice to speak to other veterans, to continue to do what I'm doing, to stand up here with a mic and be vulnerable and tell my story. So that helped. That helped me because whatever care I wasn't able to get, I found it through helping others.
So let's talk about what the VA does well, Naomi, because we didn't get that far, did we?
This is not a gotcha DAV. This is not. I mean, a VA, sorry.
It's
This is not a gotcha VA. It's not.
Yeah.
Because I will say what they do well. What they do well is they do engage with us as a veteran service organization. They do speak to us. Hey, we're thinking about doing this. What do you think about it? What do you think how do you think your members would feel about it, right? So they do continue to engage with us. They do continue to, and we help them to try to get more resources so that they can expand whatever, small initiative maybe they might have going on in South Dakota. Maybe, they have a program that's really helping, that's really working. They do have, with the Deborah Sampson Act, they now have women's clinics. Some of them have completely separate entrances so that you can feel safe and you can feel welcomed, because you should feel safe and welcomed when you're seeking health care. And so they are doing that well. And, you might be in an area where that infrastructure just isn't there yet. And I can tell you from speaking to VA, big VA, and medium VA, that they are really wanting to do that. They are really wanting to bring that gender-tailored, that gender-specific care to women veterans. And so they are really engaging in doing that well. Now, that is why we need to continue to hear from the ground up. We are a grassroots organization. We need to continue to hear from the ground up what's happening, what's not working, but also what is working on your end. Let us hear it, and so that maybe we can help VA bring it on a more national level.
Yeah. Juliet, sure. On that same note, we know that there are a lot of women who, maybe it was in the 90s that they first sought care at the VA, and those gender-specific resources just weren't there, or they had a negative experience. And so we know that re-engaging them is even more difficult. For the women veterans out there who are skeptical of seeking out care through the VA or had a bad experience, what would you say to them? Would you encourage them to, try out today's VA?
I would say find your closest DAV chapter and find your women's coordinator for that DAV chapter, and I'm very serious about that. And if you don't have a DAV chapter around you, I would say go to the VA. Every VA has a care coordinator. You can speak with that care coordinator. Some VA may call it OIF, OEF coordinator, care coordinator. Many VA has a women's clinic, or at least a firm that specializes in women's services, because not every VA right now has like a functioning one, but they do have a place for women veterans. So I would say go again. Many times I just walk them myself to the VA, or go online if they're savvy enough, go online and apply for VA services, because many women veterans that I'm meeting now in their 70s and 80s have not been connected or enrolled or registered for VA services. And so is some of the vet centers, if they don't want to go to the VA, go to the vet centers. And in Connecticut, when I meet veterans, say, I'm not going to deal with it. We have our veteran oasis at our community colleges and our universities, so go there. But I would still encourage every veteran to use the VA, because, like Naomi says, they are one of the organizations that really care and love veterans, and they are tailored for our needs.
Yeah, and I'm just going to add to that. VA, when you do go to VA, they do have wraparound services that can really help you. It may be that you go for one thing and you end up needing something else, or, they might acknowledge that you have, a different issue that you can be seen. And so they do that very well, looking at the whole person and really take advantage of those wraparound services, like the MOVE program. I mean, it's amazing. I'll tell you, because the elephant in the room. I lost 75 pounds in a year. And the reason I was able to do that was because I had a provider that listened to me, that looked at my history, looked at all the medications I was having, looked at all the problems I had, and realized, this is what you need. And so they were able to help me. And now I was pre-diabetic, and now I've completely reversed that. I was hypertensive and on 3 different medications. That's gone. Don't tell VA, this was able to help me, and really, when you feel better, I'm able to be a better mom. Yes. I'm able to be a better person. I'm able to be a better assistant national legislative director, right? So that is something that VA does do well in. So I'm sorry, I didn't mean to steal your thunder.
I'm glad you mentioned the wraparound services, because a lot of times, especially most single parents are women. So a lot of times women are dealing with either housing insecurities or something, and VA does do that well through the VA homeless program, homeless services, there's support services for veteran families, depends on what state you are. So that's what I really appreciate about VA. And one last thing, I also work with the Connecticut Veteran Legal Center. We are partners with the VA. So we work with veterans who are dealing with legal issues that's caused because of their mental health issues. So those are some of the services that I believe VA is really, really good at. And if we don't engage in VA services, probably will miss out on some of those other stuff as well.
All right, I think we have time for one more question. I'd like to start with Kim. For those who are now ready and eager and pumped to get out there with this report and this information and advocate for women veterans, what advice do you have for that kind of grassroots advocacy?
Well, with the report, if you guys, you'll get reports too, but there's also a one-sheeter that comes with that gives you some pretty astonishing facts and figures that you can start any conversation with. I actually took that one-sheeter to our South Dakota Vets Council meeting, which is the group that advises our governor, and was able to share that one-pager and the facts that were in there, and it kind of caught everybody off guard. That's a great way to start. If you don't want to bring the whole report, you don't have the whole report. Another way is to bring it into any women's events that you do. And even if you don't go through the whole report and you just share stories and have conversations with women that resonate with those stories in the report, that's healing, that's helpful, that gives strength, that gives support. So that's a couple ways to use it that are maybe easier, maybe quicker, maybe deeper, not so much facts and figures, but just a little in-depth thing and something that can start a conversation. Otherwise, get a hold of Senator Thune in South Dakota and tell him to tell his buddies to call your VA and get them moving on it like he did. But it's really easy. What National put together on this, the amount of work that they did and what they put together is fantastic, super user-friendly, super easy to take with you wherever you go and have those conversations.
Yes, please. Okay. Another place that I think that report can be is very useful is within your faith groups. Whether you worship at a church, a mosque, a synagogue, bring that report into your faith group. There's so many, especially a lot of faith groups have food pantries. So veterans and family members of veterans will often visit those. And those are places that they already trust. Even if they don't trust the VA, there's already a family dynamics there. So your churches, your synagogues, your mosques, wherever you worship, bring that report into those places and talk about it.
Thank you. Naomi, I'll end with you. Anything you'd like to say to any women veterans out there who may be struggling right now?
Reach out to your fellow sisters. Reach out to, maybe if you feel more comfortable, with one of your fellow brothers. Whatever is going to be more comfortable for you. I would also say, really take advantage of the Vet Center. I'm a huge fan of the Vet Center. I think they're underutilized. And even with active duty, they don't realize that they can go to Vet Center, because if they're dealing with military sexual trauma, and the National Guard, and if they don't feel comfortable, going to they're on base, or to a military doctor or to their community care, maybe they might feel more comfortable going to the Vet Center, because it is a closed system and they don't share the information with VA. But anyway, I would say definitely, I would say that.
Great.
What?
Yes,
Oh.
please, Kim.
I didn't okay this with my ladies up here with me, but I can tell you, I know their hearts and I know what good women they are. And any of you here at the convention that need someone to talk to or have an issue, I know we're here for you, and we mean that with our whole hearts. So if you find us or you need to find us, we're here. If there's anything we can do to help you, we're here for you.
Naomi, Kim, Juliet, thank you all so much for being here and for again so generously sharing your stories. I encourage everyone here to visit womenveterans.org, where we've broken down the report findings and recommendations. You can also download the report from there, read more personal stories, and submit your own story. Please consider sharing your story with us. Lastly, I encourage you to listen to and share our special Women Veterans Roundtable podcast episode. Naomi talked about this before. We go even more in depth with some of these personal experiences. And again, that's at womenveterans.org. And Naomi, I will turn it back over to you.
I want to thank Kim and Juliet for their candid conversation and for being vulnerable I can't speak today. Vulnerable enough to share your story publicly and making yourselves available for us whenever we need you. I just want to personally say, you are my sisters for life. I mean, come on. Again, to see part 1 of our roundtable discussion, go to womenveterans.org. For those that want to hear this, www.womenveterans.org. Go to DAV's YouTube or listen to it wherever you get your podcasts. Now, if you are currently seeking service connection, or if you have a service connection for toxic exposure through DAV and you're interested in sharing your story, please stick around after the seminar, and Elizabeth will take your information and contact you at a later time to speak with you.